and welcome. This is a series called Understanding Depression, Hope Through Treatment. My name is Mary Hanson. I'm a social worker and host of a long-running show that focuses on social and health issues. My co-host for this series is Dr. James Jordan, who is a well-known psychiatrist here in Minnesota. James is the past president of the Minnesota Psychiatric Society and the past medical director of the Ham Psychiatric Clinic, where you served as medical director for 25 years.
We're here to discuss with you an important public health problem, that is depression, a common and very treatable condition. We want to talk about it as it manifests itself across the life cycle. I will interview someone today, a young person, that will discuss with you the presence of this condition in her life and how it was that she was able to work with and improve her situation in order to get on with the maturation that she expected to have.
In the very dramatic story you're going to hear, you'll see signs of both challenge and great signs of hope and strength. After that segment and that interview, we will be back, Dr. Jordan and I, to talk more about specifics related to major depression. Stay with us.
I am Dr. Jim Jordan. My guest today is Cheree Langmade. Cheree's a nurse, a mother, and she had an experience at a very early age with depression. She's here to talk with me about it today. Cheree, thank you and welcome.
Thank you.
Can you take me back, talk about when this began and your adolescence, as I understand it?
That's right. Well, I had difficulties in school from a very young age. And my family was having problems with addiction, a divorce, losing a house to foreclosure. I got lost in the shuffle, and I was sexually assaulted when I was 12 years old and didn't receive any help or processing of that, and my life downward spiraled into depression.
An assault at age 12.
Yes.
And you didn't get help?
No, when I ended up returning home, it wasn't talked about, and nobody identified it as an issue, and at such a young age, I myself didn't want to make it a big issue.
Mm-hmm. So you kept that inside of yourself?
I did.
At age 12. What happened after that? How did things emerge?
I couldn't just go back to everything as it was and go back to the same school and go about the same routines of my day, and a friend of mine ran away, and I went looking for her downtown, and I ended up getting mixed up with the wrong people, and I was actually on the streets for several years, from 12 to 15.
So you were a runaway, and you're on the streets and without a home, and what transpires now during that period for you?
For me, what I think changed is I went to live with my father and got away from the city and all the people that I was getting into trouble with, and I enrolled in school, and through the support of my school counselor, I really didn't have a junior high education or middle school education like other students my age, and he gave me the opportunity to go into high school, and I worked really hard, got excellent grades. And
so he reached out and supported you and helped you get into school. Your grades were good?
He did.
Okay.
I had to prove myself in the beginning. I had to bring a note around to my teachers every week to show that I was following the curriculum and that I wasn't falling behind the other students, and I was doing really well, so they let me proceed.
I see. And you went on through school, and how did things unfold after that? How old are you now, by the way, at this point?
I'm 31 years old now.
Okay.
And at 16, I was pregnant with my son, so
Okay.
that wasn't That wasn't in the plan originally, and he was born before my senior year started.
Okay, you're a single mother now at 16.
Yes,
Okay.
and I graduated high school on time. I was accepted into St. Kate's, and I was going to go to school for nursing, and my parents ended up getting arrested for manufacturing drugs and had to go away to prison. My siblings were put in foster care, and my son and I were on our own. And originally we were living in my car until we could find shelter. And my first year of college, I lived in shelter.
Well, this is really a heroic story as you're telling us about it. So you're living on the street, but you're enrolled in school at St. Catherine's.
Yes.
Right? And how did that? Did you find help there? Was there someone that reached out to you?
My academic advisor, some nursing professors, that took time to really get to know me as a person and talk to me about what was happening in my personal life. There was a lot of shame about my living situation, especially in comparison to many of the other students came from great wealth and privilege. I didn't want to feel different. I wanted very much to belong and to do well in school. So
doing quite well in school.
Yes.
Yeah, very good performance in school.
I did. I graduated with above a 3.5 GPA at 21 years old with a Bachelor of Science in Nursing.
Amazing, amazing. How did you study? I mean, where did you find time to do this, the academic work? And
I waitressed overnight on the weekends, and the cash tips helped pay the bills, to get me through financially. I had some support of family to help with watch my son, and found a home daycare that I felt safe leaving him in, and it was a lot of sacrifice. And
what a resilient young woman, though. Now, are you experiencing symptoms of depression during this time? I mean, you're doing so well in school, but you have so much going on in your life, responsibility for a child. What sort of symptoms did you have?
I was still very isolated. I didn't have many friendships. My entire world was taking care of my son, making sure that the bills were covered and keeping up with my grades. And I didn't take time to reflect on myself or even my feelings about being homeless and my history and the situation with my parents and my siblings.
So you were taking care of your son, and that was the main commitment that you had, to be sure that he was taken care of.
Definitely. I wanted to give him something better than what I had.
Now, you had a mentor in here, I think you mentioned to me, as someone that really helped you in terms of your career in nursing. Can you tell me about how that person entered into your life?
After my son was born, I was assigned a public health nurse, and she came out to visit me in my home. And I was worried about having a nurse come into my home because there was a lot of issues going on in our home at that time. But she was very supportive of me. I didn't feel like she judged me as a teen mother. She encouraged me as a mother, and taught me about nursing and the field, and it really interested me, and I saw that it's something that I would really enjoy doing myself, and it pushed me to look into nursing a little harder.
Did she suggest, or did you seek professional consultation then for depression, or did you see any psychiatrist or counselor formally at that point?
At that time, I was really guarded. It was after the death of my nephew where I really I understood that there was something going on that couldn't be controlled, and that I needed to take care of within myself. And I saw a doctor, and I was formally diagnosed with depression. Started on some medications, and I tried multiple medications over the years, and they weren't very helpful.
They weren't helpful.
They weren't helpful for me. I didn't notice a big difference.
Lots of side effects. Just weren't effective.
It was more of them being ineffective. Some of the side effects were just difficulty sleeping, and I felt like some of them made me feel more anxious. I didn't like that, but I felt what was more encouraging is when I started talking to therapists. I worked in a very therapeutic work setting before, and there was a lot of therapists there that opened my eyes to things I'd never considered. And I started talking openly about my past and reflecting on things that have happened.
So you're bringing things out now and talking to your colleagues, people who were counselors there
Right.
at work. Huh? And they were helping you.
They were helping me, and then they referred me to a formal psychiatrist and psychologist where I was able to get some more formal therapy.
Okay, very good. Now, bring me up to date. Today, you're very busy,
Yes.
taking care of your family. You have a partner now.
I do.
Yeah.
I'm very grateful for where I'm at right now. I'm in a stable, loving relationship. I'm engaged. We're raising 4 children. And
Are these all your children?
these
or-
are all my children. I have a son, Dante, that is 13. Kaya is 8, Tavion's 7, Desiree is 4. So big range of ages. They're into a lot of different things, but they're amazing kids. They're doing well in school. And I'm working in the runaway intervention program, and we're reaching out to youth that are on the streets and being sexually abused, and connecting them with support and mentoring them, and trying to reach them at a point when I wish somebody would have been able to reach me.
Yeah, so here you've translated your experience, your life, your struggle, your resilience, and now it's part of your work in understanding these young people that you see in that agency where you. How is that experience? I mean, you're very empathic with these young people now, right?
It's a struggle. Every youth has their own family system and their own story. So working with young people, you have to be very individualized and really see them for who they are, and see their gifts and their strengths, and support them in their personal growth. There's not a one-size-fits-all approach to dealing with youth that have been through trauma.
If we just take a couple of minutes now, you and I, and look back over your shoulder and think about young people that are out there, what kinds of things would you say to them about their health, their mental health, what they need most in going through this transition period called adolescence? It's sort of parked between childhood and adult life. It's a period of change and sometimes, loss and stress and, in your case, trauma. But what can we say to them?
I always really encourage youth that to set goals for themselves and to think about what they want for themselves, because the difficulties of adolescence will be behind them, and there's a lot of hope, and there's so much to life afterwards, and to just give them a chance to open their eyes just to see what the world has to offer, and connect with adults that you trust and you can have open communication with. I think a lot of times during that age, youth have a lot of self-doubt, and they're not sure what's normal or what they should be feeling, or questioning, are they bad, or
Sometimes it's someone outside of your family that you
Yes.
can know and trust and that
Yes.
will help you.
It can be teachers, it can be nurses,
Right.
it can be a neighbor, an aunt, uncle, older sibling. And I think it's important that people in the community reach out to young people and support them and talk to them and get
So
to
it's
know
a
them.
community responsibility to help raise children, raise young people in schools.
Definitely.
Our
Definitely.
duty. Yeah. Well, I want to thank you so much for coming and talking to us about this experience in your life. You're quite a young woman, very, very resilient. You've learned a lot. You're giving a lot back. I wish you the best of luck in the future. Thank you
you.
so much.
Thank you.
That concludes my interview with Cheree Langmade. We will be back to talk more about depression, hope, and opportunities for evaluation and treatment.
This young woman's story is remarkable, isn't it, Dr. Jordan?
It certainly is, Mary.
She really went through what you would probably term trauma. that makes me raise the question and wonder, can trauma trigger depression, Dr. Jordan?
Very absolutely. And it's very important to think about trauma. I think most of us, when we hear the word, we think of something happening as an episode, a shock, dramatic event. But there's actually two types of trauma. There's that event type where something like the World Trade Center day, how shocking, traumatic that was for so many of us, certainly those that were there and involved in that. But there's another type of trauma, it's strain trauma. And that is the things that happen that can sort of accumulate over time. And you want to see this carefully and think about it when you're looking at children and all of us in our lives, to see the combination of shock and strain trauma. Sometimes over in battlefield situations, you have the shock of what might happen there, but also the strain and the stress of the everyday exposure to conditions that are inherently violent or potentially violent.
And I'm guessing that bad experiences, traumas, piggyback in terms of our accumulating those kinds of things.
That's right. We internalize it. It's experiential. We take it in. One of the critical things then, which has to do with psychology and experience in all of our lives, is the idea that we are able to understand what is happening here and be able to talk about it, share these experiences. That's some of the aspects of day-to-day mental health good practices, and also principles of psychotherapy, is to be able to open up and not internalize all of these experiences which are there. A lot of exposure in the media, young people and children, so forth. This is part of the life that we're living here in our society, so we have to be aware that this is the kind of thing that builds up inside of all of us.
Cheree, the young woman that you just interviewed, said that she held a lot of the trauma that she'd gone through inside. She didn't want to talk about it. She didn't tell people. And that probably, for most of us, would kind of compound the effects of it.
Yeah, absolutely. I mean, it's a normal response to defend oneself, to sort of try to manage things, be self-reliant. Here's a young person growing, and the idea of being autonomous, self-reliant, independent is a very, very important thing for an adolescent. So you can see that thrust, that normal, healthy thrust. On the other hand, if there's things happening that are over the top or cumulative, and then in the case of a violent episode, or someone is assaulted, then all of that goes inside, and it can have some manifestations in a clinical situation like depression or anxiety, spectrum problems. And so this is what you're looking for, is that normal sort of thrust of development, self-reliance, someone moving towards independence, and then some of those healthy defenses being used to cope with a difficult situation, sometimes overwhelming situation like she described.
Major depression can be caused by other things too, though, can't it? A lot of people talk about the chemical imbalance in the brain and sort of put their cards on that characteristic. However, you don't feel that that is a primary cause, do you, Dr. Jordan?
Well, I think we have to be careful isolating that factor in terms of talking about someone having a chemical deficiency in their brain. There's theory out there that says that there seems to be or appears to be some chemical disruption in the neurotransmitters that then are associated with or correlated with depression. And that's more or less where the science is. We'll learn more about that with time and further investigation. But to assert right now, based on the information we have, that someone is lacking, certain chemicals, I think is going beyond the evidence of the research. We know that there's chemical disequilibrium, and medications can help restore some balance in that. But once again, medications are not without side effects. So there's always a advantage, again, an idea of, well, we're going to do something, but you have to manage that against what is the downside, what are the side effects. And so you're doing that always when you're using medications. In this case, putting medication in the central nervous system, in the brain, a pretty thoughtful approach, necessary and appropriate, but supervised, closely monitored, and certainly with children, but I think with all of us across time. The use of these medications is very, very important to understand, want our audience to understand it, and also to have a notion of understanding also that the limits of the science are that may not necessarily be a chemical deficiency so much as a disruption.
So you're saying that if we would put all our bets on chemical imbalance, that would mean that meds would be more important proportionately than perhaps they are in treatment.
That's right.
I want to go back just a minute to talk more, though, about cause before we talk more about treatment in this regard. Family history. If my dad was depressed, am I more likely to have depression? What is the genetic connection?
There is a factor in terms of one's heredity, where if there's a family history of depression, then it can manifest itself in the children of that parent. It isn't necessarily the case. You have the potential for a manifestation of depression, but so we'd say you have the genetic makeup. Will that manifest itself? It depends, because you never see genes, genetic genes in isolation. You see it in the context of the environment. So it may be that some member of that family might manifest a depressive or major depressive problem. On the other hand, others may not. So
very similar to if one was talking about heart disease or
exactly,
diabetes.
Exactly, yeah.
In terms of how depression looks when we're talking about a young person like Cheree versus older persons whom you'll be introducing us to later, does depression look differently in general when we're looking at a young person with symptoms?
It certainly does. I mean, young people are creatures of their behavior, of their outlook. There's a lot of transient emotions that are normal in children, adolescents, and so forth. So they may have features that are not necessarily classic for depression, but you can see their behavior or their mood might be compromised or depressed for a period of time. And then if it doesn't shift or change, it's persistent. I think that's something to look at, take into consideration. You have trained observers out there, teachers. Parents should be paying attention to their children's conduct. And when there's questions that come up, I bring this to the attention of your pediatrician, your doctor, get a screening or evaluation done. Don't let it go if you have
young
concerns.
People can be depressed, and
Yes.
often it's the behavioral symptoms.
Mm-hmm.
I want to talk just a minute more about meds with you, because there's been some interesting information that's saying that physicians are actually reimbursed more for prescribing antidepressant meds than they would be for doing therapy or having a psychologist or psychiatrist do therapy. Is this accurate information? Am I correct in my understanding?
I would say that's essentially the case. It's a dilemma for physicians, for psychiatrists, in that doing what is appropriate and what is necessary for a patient is taking the time certainly to evaluate them and then have a proportion amount of exposure to giving attention to psychotherapy, and then the time for medication and managing this. To be confined to a certain amount of time limits physicians to taking out a prescription pad and writing a prescription. And there's a lot of pressure, a lot of direct advertising, and where individuals come in looking for medication as the answer, the quick fix. And this is very problematic for physicians that really want to take time, need to take time to examine the patient. Good practices.
And with the pressure on the healthcare system, time is always tight for physicians. Cheree talked about not being able to really benefit from meds, and yet they tried many meds with her, obviously, from what she said. Is this quite common, Jim, that a patient will not respond to meds at all?
It's not uncommon. About, I would say, a third of our patients do not respond to medication as a component of their care. That being the case, for mild and moderate depression, psychotherapy is critical to put in place for individuals so that as you're going through the medication trials, and I use the word trials because it's plural, very often you don't get a response to the first trial. You're talking about a 4 to 8 week period, then another trial has to ensue. So you need to have the time to work with the medication, and multiple trials is common.
Well, thank you, Dr. Jordan. We'll come back to this topic, I'm sure, in the ensuing shows. We're going to now close this program. We want to thank you for watching. We want to thank our supporters and contributors who made it possible. We want to thank KSTP Television, and we hope you will join us next week when Dr. Jordan will interview another person who is dealing with depression. Thanks for being with us. If you or someone you know is dealing with depression and needs help right now, call 911. If you want to know where to go in your area for an assessment and or for treatment, you may call 211. This number can connect you to mental health resources throughout the United States.